In the high-stakes environment of surgery, where every second and every tool can mean the difference between life and death, the surgical technologist stands as a critical team member. This role supports surgeons and nurses by preparing operating rooms, managing instruments, and ensuring procedures run smoothly. The job description of a surgical technologist revolves around technical expertise, focus, and teamwork, making it a vital component of patient care. Let's explore what this position entails, the skills it demands, and why it's a cornerstone of successful surgeries. What does a surgical technologist do? A surgical technologist, often called a scrub tech or operating room technician, assists during surgical procedures by setting up sterile fields, handling instruments, and anticipating the needs of the surgical team. They work in hospitals, outpatient centers, or specialty clinics, contributing to operations ranging from appendectomies to heart bypasses. Under the direction of surgeons and registered nurses, they ensure the operating room is a seamless, efficient space. Picture them as the silent orchestrators of surgery, organizing tools, maintaining sterility, and keeping pace with the procedure. They're the steady hands that enable precision under pressure, one scalpel at a time. Core responsibilities in focus. The job description of a surgical technologist adapts to the procedure but centers on key duties. Here's what they typically handle. 1. Operating room preparation. They set up sterile tables, arrange instruments, and ensure equipment, like lights or monitors, is ready. 2. Instrument management. Passing scalpels, forceps, or sutures during surgery, they keep tools flowing to the surgeon's hands. 3. Sterility maintenance. Monitoring the field, gowning staff, or draping patients, they guard against contamination. 4. Assisting during procedures. Holding retractors, cutting sutures, or managing specimens, they support the surgical process directly. 5. Post-operative cleanup. Counting instruments, disposing of sharps, or prepping the room for the next case, they wrap up efficiently. These tasks position the surgical technologist as a preparer and partner, meticulous, alert, ensuring surgeries succeed. Skills that define the role. To excel as a surgical technologist, a specialized skill set is essential. Technical proficiency leads, mastering instruments, sterilization, or anatomy requires training and dexterity. Attention to detail is critical. A missed sponge or unsterile glove can jeopardize outcomes. Calm under pressure shines. Staying steady amid blood or beeps takes grit. Teamwork matters, too. Syncing with surgeons and nurses keeps the rhythm tight. Stamina rounds it out. Standing for hours in tense settings tests physical and mental endurance. A day in the life of a surgical technologist. Let's shadow Carlos, a surgical technologist in a busy hospital. His shift starts at 6 a.m. with a hip replacement. He lays out drills, screws, and drapes by 6:30. At 7, he gowns the surgeon, then passes tools as bone is reshaped, his hands quick and sure. Mid-morning, an emergency appendectomy hits. Carlos scrubs in fast, setting a sterile field in minutes. At noon, he's on a gallbladder case, holding a retractor steady for an hour. Afternoon brings a cleanup. He counts needles, logs gear, and resets for tomorrow. By 3 p.m., he's done, 3 lives steadied by his work. Challenges and rewards. The role carries weight. Stress looms, urgent cases or long shifts test nerves and focus. Physical demands hit. Standing for hours or lifting heavy trays wears on the body. Sterility pressure stings, a single slip risks infection. Emotional toll lurks, too, tough cases or patient losses linger. Yet rewards cut deep. Helping save a life offers quiet triumph. Skills sharp and fast. Each surgery hones precision and poise. Pays solid. Median $57,000 per BLS, and demand grows with aging populations. It's a field where steady hands find purpose amid the chaos. Why surgical technologists matter. Surgical technologists are the backbone of the operating room. Without them, surgeries stall, instruments vanish, fields falter. Their prep keeps procedures on track, their vigilance protects patients. They're the unsung enablers who turn a surgeon's skill into success, ensuring every cut heals. Their presence streamlines chaos into order. A well-set tray speeds a critical moment. a counted sponge averts disaster. They bridge preparation and action, making the OR a place of precision rather than panic. The broader impact. Their work ripples beyond the table. In healthcare, they boost efficiency. Faster surgeries mean more patients served. In emergencies, they're lifelines. Quick setups save minutes that save lives. In training, they model focus. New techs learn from their calm. As surgeries rise, over 15 million yearly in the US per CDC, they meet a swelling need, proving their reach. They also uphold safety and care. A sterile field fights infection, a daily win for patient recovery. Their role blends tech with touch, ensuring human lives rest on meticulous hands. It's a position where small acts yield big outcomes. Pathways and opportunities. Becoming a surgical technologist starts with education, a certificate or associate's degree, 1-2 years, in surgical technology is typical. Programs teach anatomy, sterilization, and hands-on skills, followed by certification, like the CST from NBSTSA, after clinical hours. Hospitals or schools provide the path, dedication seals it. Growth stretches wide. Some specialize, cardiac, ortho, or climb to surgical assistant roles with more training. Others pivot, nursing, equipment sales, using skills like focus or tech savvy. It's a career with roots and room to rise. How does context shape the role? The technologist's focus shifts by setting. In general surgery, it's variety, appendices, hernias. In specialties, it's depth, hearts, brains. In outpatient, it's pace, quick turnarounds. The core holds. Prep, assist, clean. This range keeps the role vital across surgical fields. Technology's role. Tech's a quiet ally here. Machines, like laparoscopic towers, aid minimally invasive work. Techs run them. Sterilizers hum with precision, monitors track vitals. Basic tech skills, adjusting settings, troubleshooting, are now key, enhancing accuracy but adding complexity. Tools of the trade. Their kit is sharp and sterile. Trays hold scalpels, clamps, essentials for every cut. Drapes and gowns shield fields, counters track gear. Modern boosts, endoscopes, robotic arms, extend their reach. Each tool turns prep into precision, making them extensions of the team. The physical and emotional balance. The job's a full body test. Hands pass tools. Legs stand firm for hours. Emotionally, it's a tightrope. Focus trumps fear in tense moments. Alertness is all. A lapse risks all. It's a dance of endurance and calm, demanding both in sync. Conclusion. The surgical technologist is the steady pulse of the operating room, weaving preparation into life-saving action with skill and care. They set, support, and safeguard, often unseen, always essential. Their work ensures surgeries heal rather than harm, proving its worth in every sterile step.